Welcome to the Radically Genuine Podcast. I am Dr. Roger McFillin. In the shadowy corridors of modern psychiatry, and it is shadowy, it is dark, lurks a silent epidemic, one that's ruined countless lives while hiding behind the mask of help. Today, we pull back the curtain on medical catastrophes that's been brewing for decades, the reckless overprescription of psychotropic drugs, and the harrowing struggle of those trying to break free from their chemical shackles. Imagine being told that a cocktail of pills would lift the fog of depression, sharpen your focus, and stabilize your mood, all under the guise of scientific progress and safety. Now imagine finding yourself trapped in a nightmare far worse than one you sought to escape. For millions around the world, this isn't imagination, it's reality. These individuals have become unwitting victims of a system that prioritizes quick fixes and polypharmacy over long-term healing, where the cure has become nothing more than a devastating disease in itself. The allure is undeniable, a pill for every ill, a chemical solution for life's complexities. But beneath this seductive promise lies a darker truth. What began as a single prescription often cascades into a dangerous dance of multiple drugs, each attempting to counteract the side effects of the others. This isn't healthcare. It's a perilous game of pharmaceutical Jenga with patients' lives hanging in the balance. Yet, in this bleak landscape, there is some beacon of hope. Many of my audience members have inquired about solutions. What happens when you are stuck in this cycle of despair and you don't know how to get off these drugs? Well, for today, it's the opportunity for me to interview a pharmacist. These often overlooked healthcare professionals stand at the critical intersection between prescriber and patient. They're the ones who see the full picture of a patient's medication regimen, who witness firsthand the escalating cocktail of drugs many are prescribed outside of any safety, any efficacy, any long-term evaluation. And as they fill these prescriptions, they're becoming increasingly aware of the dangers and harms of these practices. Our guest today is one such pharmacist. Positioned on the front lines of this crisis, he has witnessed the carnage wrought by careless prescribing practices and the pharmaceutical industry's iron grip on mental health treatment. He's seen patients spiral into debilitating withdrawal symptoms, their lives derailed by the very medications that are meant to save them. Through careful tapering, holistic approaches, and recognition of the human spirit, I think there is opportunities for us to reclaim lives from the clutches of chemical dependency. But we need more information. We need more research. We need ethical professionals of all healthcare specialties to speak out. Today, I'm hoping he not only exposes the hidden dangers lurking behind these prescription cocktails, but also illuminates the path to freedom. I want to welcome Dr. Shawn Gill, who is a pharmacist, writer, podcaster, and entrepreneur dedicated to sparking change in healthcare through deprescribing. He's the founder of Deprescribe Solutions, an independent consulting practice focused on the reversing of early stage chronic conditions in mental health, hypertension, and type 2 diabetes, which, interestingly enough, all kind of coincide and work together. Dr. Gill hosts the Deprescribe podcast and writes in the Substack newsletter B.U.D.S, B.U.D.S, where he explores topics in health, deprescribing, parenting, and personal growth. His mission is to inspire patients to take charge of their health by challenging conventional approaches and exploring topics. They range from mindfulness, resilience, lifestyle interventions to reduce reliance on medications. And let's face it, where we're at now, it has to be a grassroots effort. Patients are going to have to take control of their healthcare because entering into the sick care system, you're going to get the same nonsense, and you'll be dependent on drugs that are trying to treat symptoms and don't certainly in any way treat or work with the root causes of such of those conditions. Dr. Gill received his Doctor of Pharmacy from the University of Toronto, Leslie Dan Faculty of Pharmacy in 2015, with extensive experience spanning hospital, outpatient, and community pharmacy. He brings a unique perspective to his work in integrative healthcare, where he combines traditional pharmacy practices with innovative approaches. I want to welcome Dr. Gill to the Radically Genuine podcast.
Roger, thanks for having me.
Well, many of my listeners have reached out. They are asking me to do an episode on deprescribing, life after psych drugs. But let's just introduce you first to the Radically Genuine audience. Let's know about your background. And honestly, I want to learn more about pharmacy and how pharmacists can be part of the solution moving forward.
Yeah, well, thanks for the introduction. So a little bit about my background, Roger. I started off in pharmacy when I was 16 years of age. So I've dedicated half my life to this profession. I started off at my local community pharmacy, just stocking shelves. And I discovered a passion through the profession and this ability to really touch patients' lives and help them. So I decided to pursue the career of pharmacy. I went to University of Toronto, graduated in 2015 at the tender age of 24. And I got my first experience in hospital setting at my local community hospital here where I was born and raised in Oakville, Ontario. I was there for about 4.5 years, Roger, and I got to dibble-dabble in a lot of different specialties: ophthalmology, cancer care, cardiovascular, fractures, and orthopedics. And then we also had outpatient mental health and neuropsychiatry. But then in 2019, I took a new position in a more integrative model where I work at a compounding pharmacy now, and we're attached to a pediatric urgent care and a family medicine walk-in practice. So it wasn't until the pandemic where I started paying more attention to this rising epidemic of mental health. And around that time in December 2020, I also welcomed the birth of my first son, my first child. And as you know, Roger, once you have children, your perspective really changes. And I just kept seeing more and more patients coming into the pharmacy. Around this time with the global pandemic, a lot of isolation, a lot of loneliness, and a lot of surge in anxiety and depression, and saw more and more people getting prescribed SSRIs from all ages, teenagers, Gen Zs, millennials, my age. And I thought I need to be doing more to kind of counter this onslaught of mental health. And deprescribing, Roger, really came into my radar when I was still in pharmacy school. It's a concept that's typically utilized in geriatrics. So I remember being in my third year geriatrics elective, and we had a lecture series on polypharmacy, and that's where I first discovered the term deprescribing. And it was kind of like a light bulb moment in my head. I thought, we need to be utilizing deprescribing, not just in geriatrics where there are a variety of issues with polypharmacy, drug interactions, side effects that can compound in that patient population. I always thought that we should be applying deprescribing right at the onset of a diagnosis, right at the onset of prescription for anxiety or depression, early stage hypertension, metabolic syndrome, diabetes, you name it. That is really the best time to have that conversation with the patient on what are your intended goals of medication therapy, how long do you want to be on this medication, and how can we prevent the progression of this condition. So that was where my passion kind of ignited. And I always thought about deprescribing, and I tried integrating it into my practice when I was at the hospital and then when I was at the compounding pharmacy. But it wasn't until, like I said, when my son was born, where I really had that change in perspective and started thinking I need to be doing more to counteract this problem that I'm seeing more of in my clinical practice, which is the rise of mental health affecting all ages and especially the youth.
Let me follow up on some definitions. Let's start with compounding pharmacy. You mentioned that as where you're currently working. Can you explain what that means?
Sure. So compounding pharmacy is a specialty pharmacy where we're able to make specialized dosages for patients. And compounding comes into play when patients need to access certain medications that are not commercially available or manufactured at a broad scale. So for example, our compounding pharmacy specializes in pain management. So the owner of the pharmacy is a brilliant guy, and he actually created a compounded cream medication that we use for neuropathic pain and also arthritis as well. So we would take powders that we would order from USP grade pharmacopoeia wholesalers in the United States, and putting them into a base cream, we would mix all these different powders into this cream formulation. And with compounding, it allows you to really become creative with dosing and also different types of formulations. So in the context of mental health, what I thought was maybe we could start compounding specific oral solutions to help facilitate tapers for individuals that are looking to come off their SSRIs. So compounding really allows you to be flexible and customizable with your dosing and your approach to tackling certain conditions.
Great, thank you. And you also mentioned polypharmacy, which is, I think, really, really important. Before I start talking about my experiences with polypharmacy, can you just, again, a definition of what that means and what you are observing in your own practice?
Sure. So polypharmacy is defined as being on 5 or more prescription medications for a chronic condition. So typically we would see polypharmacy in the geriatric population. That's where you have grandpa or grandma. They're at later stages of their lives, and chronic conditions like metabolic syndrome or metabolic diseases, cardiovascular diseases, cancer, neurodegenerative diseases, they begin to take a lot of toll on the individual. And oftentimes medications are often prescribed to address those concerns. But polypharmacy can also occur when you have things like prescribing cascades. That's when an individual is prescribed a medication, they experience a side effect, and from that side effect, they're prescribed another medication to address it. So these are typical issues that can occur when you have multiple medications. And from the perspective of deprescribing, polypharmacy really is the enemy because it can lead to an array of different issues. For example, when you have certain side effects from certain medications that may be causing similar side effects, for example, if you have an individual in their 70s or 80s and they're on, say, a medication for sleep, a sleeping pill like Zopiclone, it can cause sedation. They may be on another medication for something like overactive bladder, which is an anticholinergic medication like oxybutynin, that can also cause sedation. And these side effects begin to compound and affect the patient negatively. Polypharmacy can also lead to issues of drug interactions as well. So that's go ahead.
Which is my question, because I want to stay focused on mental health, and I am seeing polypharmacy becoming more and more the norm here in the United States, not just with an elderly population. I'm talking about with teenagers. I just got done with an evaluation of a 19-year-old on 7 psychiatric drugs, which included 2 benzodiazepines. So gone for me are the days where somebody is just prescribed one, like one SSRI. And I know we're going to talk about SSRIs today because people don't know how to get off of them and they need help to get off of them. But polypharmacy, I am seeing what might start with an SSRI, might start with a stimulant, then becomes evolving into adding what's called a mood stabilizer or an antipsychotic, additional SSRI, an SSNRI. And it is certainly like another drug prescribed for the side effect of another drug, or what just looks like to me on the surface, a doctor is trying to emotionally blunt and sedate a person into a complete different state of consciousness, which ethically, scientifically, I haven't been able to ever identify where that is effective other than in destroying the health of the individual, right? So what supports such practices? If these are becoming more commonplace, where is the science around this? And God, I've never found one study that evaluates somebody on 5 psychiatric drugs, but yet they're doing it. Why? And then what can a pharmacist do about this?
I totally agree. Actually, sorry, I went off a little tangent. They're talking about geriatrics, but bringing it back to mental health, Roger, even 2 weeks ago, I had a case just like that. I had an individual, she was a female in her teenage years, prescribed an antidepressant, SSRI. She was on Zoloft. She was following up with her psychiatrist, who then prescribed her lurasidone, a second-generation antipsychotic, for adjunct for her depression. And I took the mother aside and we really had a conversation, and I wanted to make sure that she was informed of the risks and the benefits of this medication potentially. And pointing to your question, I agree. There's really a paucity of information and research on the effectiveness of these medications, especially in the context of polypharmacy. Oftentimes, I do see a lot of cocktails being prescribed to individuals when they're first initiating a medicine for anxiety or depression. We typically see like an SSRI or a medicine for sleep like Zopiclone or any other sleeping pill, in addition to a benzodiazepine for PRN or as needed anxiety. So when individuals come to me with that prescription, I will typically put them aside and say, well, how can we trim this down and even avoid taking any of these medications to the point where we can focus on implementing more lifestyle interventions? And what have you tried? What have you not tried? And really trying to understand, first of all, where their anxiety or depression or symptoms are coming from. And also having that sort of discussion with the patient about how can we approach this from alternative methods? Because oftentimes I see these medications even being prescribed for very trivial reasons. For example, a lot of patients of mine, they come to me and they may not be having severe depressive symptoms or severe and anxious symptoms. It could just be something benign as struggling with deadlines at work. I see a lot of students, for example, in university, they're trying to cope with the pressures of achieving certain GPAs or getting into their graduate programs. And when they tell their physicians, they open up to them the quick fix and the quick solution is to get out the prescription pad and prescribe that SSRI or prescribe that, that benzodiazepine for PR and anxiety. And oftentimes, unfortunately, in my profession as well, pharmacists, which are really the gatekeepers for medications, we're really stewards of medication. I feel like we're not doing our due diligence in making sure and assessing the appropriateness of these prescriptions. It's often we get the prescription, we say, take with food, off you go and see you for your refill. And there isn't much follow-up. But what I've been trying to do with my practice is to really give my patients time and to really break down and understand why they're here in the first place and to find unique solutions to help them rely less on medications and more on lifestyle interventions and things that actually work over time, as opposed to just masking symptoms, blunting emotions, and really being put on that slippery slope of taking a medication for an undefined period of time, which may lead to more harm than benefit.